And about kids, things have changed from the time we last spoke, from being just carriers to being infected. So maybe a minute on generally what you see, what studies show with respect to children getting infected.
Let me add one caveat first. The caveat is that the new variants, we're still figuring out what's going on, right? So we still don't know entirely everything about it. But actually, 2 days ago, I wrote an editorial in a Spanish newspaper. I didn't write it in Spanish. I wrote it in English, and then they translated in El País, because they had exactly this question about, can they open preschools? The risk to children under the age of 10, either of acquiring the virus, of transmitting the virus to someone outside of the age group, is extremely small. Now, it is unusual for for people to study these pathogens, is because typically these small kids are lethal. They're the ones who carry a lot of bugs and bring it to the elderly and so forth. That is not happening in this case. In fact, in all the evidence that we have from the US, across Latin America, where this concern is very high, reopening of preschools, daycares has not resulted in a spike in infections. The young adults who are age 15 and above or 14 and above, those folks behave much more like other young adults who are in the 20 plus age group. So they're also children, I guess, from where we sit. But they are probably at higher risk both of getting it and transmitting it. But again, their risk of terrible outcomes is really low. Remember, if you're under 35, you shouldn't even be watching this, because this is not even, it's not even relevant to you beyond, taking care of your parents or grandparents or something. You're at extremely low risk of getting or suffering from the disease or anything like this. But I think that preschools, daycares, from the data that we had previously, that there is really not much of a risk there.